Well, the lingering dangers of smoke, why vitamin supplements may not be necessary, and one more reason to eat chocolate.
I like that one. All right, Dr. Nancy Simpkins is a board-certified internist and is here to discuss some of today's hottest health headlines. So good morning. Thank you for coming in.
Good morning. Thanks for having me.
Now, we've all been aware of secondhand smoke and the dangers of that, but now we're hearing about third-hand smoke. What is that exactly?
Right, this is a relatively new concept about smoking indoors, number one. So this is happening only indoors, so that's the number one thing people have to know. And it accumulates on things such as our couch and our pillows and the byproducts of smoke. And the things that it's most dangerous to, which you'll be interested in, is baby toys and things that people are going to put into their mouths, because then there's carcinogens right on them that go into the system of a small child. Oh, wow. So it is actually very dangerous. So if you currently are worried about it, you should clean all of your furniture, all of your pillows, and do not allow smoking indoors.
Now, what about the walls? I mean, obviously, you smoke in a house, in a building, the walls and the...
That's right. And you have to, there's not much you can do about that, which is why you have to prevent smoking indoors your house. It's really, really very dangerous, especially for small children.
Wow, okay. Well, now, we also heard about a new study that suggests that the benefits of some vitamin supplements aren't really what they seem.
Okay, I'm not a big fan of vitamins or supplements. I'm a big fan of eating your vitamins. Okay. So, have an orange, have a yogurt, have a piece of salmon. You've had enough vitamins and supplements for an entire week. Anything more that you're going to take, you're going to take some excess vitamin C because you think you're getting a cold, your body can't store that. It's just going to come right out. So your toilet will have extra vitamin C, so good for your toilet. It will not get a cold. But it will not stay in your body. And some of the vitamins that are stored can actually cause liver damage.
Right, but then why is it so important when, you know, for example, when you're pregnant to take those prenatals?
Okay, that's different. The folic acid has been proven, excess folic acid in pregnancy to prevent neural tube damage. That's a definite. Okay. Prenatal vitamins are an exception to every rule. Those must be taken.
But then also, what about the older set who may have a B12 deficiency, which is very common?
Very rare.
Oh, really?
People want to say it's common.
See, I've heard it's very common. Okay.
But no, but actual B12 deficiency is really rare, and if you do need B12, it has to be given injectable. Because it's not absorbed from the stomach.
Sublingually.
So there's a multi-million-dollar business with all these supplements out there.
$28 billion a year. And
I'm a sucker. I'm one of them.
Fruit and vegetables.
Okay.
I'm like a granny. I have the case with all the little Monday, Tuesday, Wednesday, Thursday, Friday compartments.
Okay, well, find some other way to spend your money.
All right,
gladly on shoes.
All right, so we know about high blood pressure, and that's bad, but new research suggests even a little increase can be dangerous.
There was just a new study in the Journal of Neurology saying that normally we don't treat blood pressure till we reach a systolic blood pressure of 140 or a diastolic of 90, right? But now we're learning that between 120 and 80 and 140 and 90, there's a gray zone. And those people in the gray zone are having an increased risk of stroke. So what do we do with those people? Because we don't want to put them on medication. So that's the group that we advise diet and exercise. So losing weight, increasing your cardiovascular exercise will prevent stroke in that gray zone where you do not need to take medication. So that's the good news.
But easy fixes for people to incorporate into their lives. Absolutely. Okay, so now tell me this. Dark chocolate does wonders for the heart. Just another reason for me to just have some more after dinner.
Right?
Yes.
I know. I'm a big fan myself. Yes. So the thing about dark chocolate is it has anti-inflammatory properties. Heart disease is really inflammation. Inside your coronary arteries, it's just inflammation. And then as the blood cells go by, the inflammation causes stickiness and causes a blockage. So what does the dark chocolate do? It's an anti-inflammatory, and it just wipes out your coronary arteries.
So what is it that's in the dark chocolate different than the milk chocolate and the white chocolate?
There's more flavonoids, which is in the cocoa plant. So the darker the chocolate, the purer the dark chocolate, the higher the level of flavonoid, the more anti-inflammatory.
Call it what you want. I call it delicious, and I appreciate your information.
And I love
Thank
it.
you so much,
Have a
Dr.
great day.
Nancy Simpkins. We appreciate you.